So, what is person-centered care? There are many definitions in various sources. According to McCormack and McCants, person-centered care is an approach to practice established through the formation and fostering of healthful relationships between all care providers, service users and their significant others. It is underpinned by values of respect, individual rights to self-determination, mutual respect and understanding. It is enabled by cultures of empowerment that foster continuous approaches to practice development. Considering all definitions, the key principles of person-centered care come down to, firstly, valuing people. Treating people with dignity and respect by being aware of and supporting personal perspectives, values, beliefs and preferences, as well as listening to each other and working in partnership to design and deliver services. Secondly is autonomy, which focuses on the provision of choice and subsequent respect for choices made. The importance for balancing rights, risks and responsibilities, also optimizing a person's control through the sharing of power and decision making. And finally, maximizing independence by building on individual strengths, interests and abilities. Thirdly is life experience. So by supporting the sense of self by understanding the importance of a person's past, present experiences and also their hopes for the future. Fourthly is understanding relationships. We must understand collaborative relationships between the service provider and service user, and also the carers and between staffing levels. Social connectedness through the local community through opportunities to engage in meaningful activities. And finally is the environment. Organisational values underpinned by person-centred principles. The responsive support that is responsive for individual needs. A planned organisation-wide effort to individual and organisational learning. There are certain factors relevant to the care environment which must all be considered for person-centred care. These include appropriate skill mix, systems that facilitate shared decision-making, the sharing of power, effective staff relationships, organisational systems that are supportive, the potential for innovation and risk-taking, and finally the physical environment of the healthcare centre. So firstly, appropriate skill mix. Skill mix is often considered in a nursing context, and this defines the ratio of registered nurses and non-registered nurses together in a ward unit nursing team. In a multidisciplinary context, meaning the range of staff with the required prerequisite knowledge and skills to provide quality nursing care. Nursing care consists of various parts, so regardless of whether a registered nurse or an enrolled nurse, everyone has their own responsibilities to take care of patients. However, all staff members that have different skills in that particular unit should help and support each other to provide a high level of nursing care. According to Buchan and Kalman, skill mix is a relatively broad term that can refer to the mix of staff in the workplace or the demarcation of the roles and activities among different categories of staff. Health systems performance between physicians and nurses have been improved by using skill mix changes that most of the policy pay more attention to. Systems that facilitate shared decision making. To define this further, organisational commitment of collaborative input and engagement between the team in healthcare. Shared decision making highlights the importance of listening to all opinions to build an effective team in the healthcare system. It is essential that staff experience ways of engaging that facilitate active participation in decision making. This requires interpersonal connections that are productive in the achievement of holistic person-centered care. The sharing of power. A non-dominant, non-hierarchical relationship that does not exploit individuals but instead are concerned with the achieving the best mutually agreed outcomes through agreed values, goals, wishes and desires. Effective staff relationships is closely linked to the issue of power sharing. Whatever approach to ongoing team development is chosen, the issue of power in teams is an inevitable issue and one that is important to consider when considering the development of shared decision-making and person-centered practice. Effective staff relationships. In dialogue surrounding person-centeredness, there is propensity, often at a subconscious level, to think in terms of the patient and their family, while often forgetting that we are also to focus on the relationships within the team as well. The simple premise within the framework is that we should pay attention not just to how we develop positive relationships with our patients, but also how we care for the relationships with our team. So how do we build up an effective relationship? The interaction between professionals should be based on the same standard of respect and values. Organisational systems that are supportive. We need organisational systems that promote initiative, creativity, freedom and safety of persons, underpinned by a governance framework that emphasises culture, relationships, values, communication, professional autonomy and accountability. While supportive systems at a team level are essential, it is important to recognise that teams within a wider organisational context, which can have a significant impact on team functioning. There has been research to illustrate the organisational conditions that are necessary for staff to feel empowered. Their success is associated with 3 areas that would have relevance to multi-professional teams. Firstly is administration, decentralised structures, flexible working, participatory and supportive management style, adequate staffing, the use of specialists, and well-prepared and qualified executives. Secondly is professional practice. Professional practice models of delivery, associated autonomy and responsibility, availability of specialist advice and emphasis on teaching. And lastly, professional development, which means a planned orientation of staff, emphasising on in-service continuing education, competency-based clinical ladders and management development. The findings from research by Aiken and colleagues reinforce the need for staff to be recognised, supported and involved in decision-making about patient care and hospital governance through professional autonomy and environment supportive of professional practice and development and strong supportive leadership. Potential for innovation and risk-taking. Exercising of professional accountability in decision-making that reflects a balance between the best available evidence, professional judgment, local information with patient family preferences. Professional autonomy is one of the most leading preferences to a nurse's job satisfaction. Everyone should show their initiative in their role and complete what they can do independently. It is an ability of decision-making to provide a balance between best available evidence, professional judgment, local information and patient family preferences. It is still argued that nurses need to engage with 4 processes in interconnected relationship with patients in order to facilitate adaptation and decision making. These 4 processes form the foundation of innovation and risk-taking and can equally be applied in multi-professional context. The 4 processes include 1. The facilitation of decision-making through information sharing and the integration of new information into established perspectives and care practices. 2. The recognition of the importance of individual values for decision-making and of knowing how each person's values will influence the decisions made. 3. Making explicit of intentions, motivations for actions and the boundaries within which care decisions are set. And 4, the creation of a culture of care that values the views of the patient as a legitimate basis for decision making, whilst recognising that the older person perhaps does not always need to be the final arbiter of decisions. And last but not least, the physical environment of the healthcare centre is the last in framework. The healthcare environment balances aesthetics with function by paying attention to design, dignity, privacy, sanctuary, choice, control, safety and universal access with the intention of improving patient, family and staff operational performance and outcomes. There is now a wide evidence base demonstrating the importance of the physical environment to care and for optimal healing. For example, most hospitals and health facilities provide single rooms for specific patients and their family. While this does reduce infection risks, also does provide privacy and an overall happier stay for the patient and their loved ones. There are several challenges faced by leaders in the world of nursing practice. Globally, due to the trend of cost-effective service in the healthcare environment, skillful nurses are lacking. As a result, a leader has to make a complex decision of allocating the mixed skill staff according to their qualification and nature of work. Secondly, a leader in this profession needs to have strong skills in performing several tasks such as evaluating critical situations, managing conflict, reviewing cases, developing teams and counselling families, and the list does go on. Due to hierarchical structures within the nursing field, there is an existence of positional power in the care environment which has given rise to hierarchical decision-making strategies. For example, the experienced and older nurse manager will have more power over a decision-making process than the new, younger nurse manager. 4. Heavy workload due to inadequate staff and limited resources also causes hindrances for a nurse leader in creating person-centered culture. Due to the minimum number of staff and few resources, there is an increase in the number of managerial tasks, which can lead also to stress, anxiety, physical burden, and also less time to spend focusing on person-centered care, evidently. And 5. Lack of support by the organisation is another challenge which is faced by many nurse leaders. They are deprived of consistent training and career development programs, which also plays a vital role of increasing effectiveness in person-centered care. Finally, I'll discuss a good example of a practice innovation in healthcare designed to support person-centered care in the care environment. This would be to implement systems to support meaningful partnerships with patients, carers, and consumers. Some of these systems may include a complaint management process involving consumers in decisions about their care and informed consent, etc. This is so important as it will allow nurses and carers to practice patient-centered care with the residents or the patient's environment by building a relationship with each individual patient and allowing them to have their say. This will also then allow such a strong understanding and knowledge base about their care and their treatment. Overall, this will build on patient-centered care and patient advocacy. A nursing innovation that links to person-centered care in the care environment is creating these needed meaningful relationships, showing extra attention to culture, teamwork, reducing routines, facilitating more choice, and having a positive impact on the patient. The nurse can also promote individual accountability for person-centered care. Both of these approaches will help create a person-centered culture and contribute to person-centered care within the care environment.